Well, there is a very alarming statistic which is there, and that is for mental health. There are many suicides that take place every day. As per WHO report, 1 out of 4 adults in their lifetime would go through a mental or a neurological disorder, and which is a major cause of illness and disability. Well, today we are celebrating World Mental Health Day, and it's extremely important to understand mental health and its implications. Often we do not realize what's going on within the confines of our minds, or anybody's mind for that matter. Physical ailments, easy to see, easy to diagnose, and you can relate and empathize or even understand what the person is going through. But many times it so happens that even the person who's undergoing a mental health issue or a challenge is not aware of what really is going on. And it's extremely important to understand mental health and the importance of mental health that it has in our daily lives. So today, on this journey, we would be looking at the integrated relationship between homeopathy and mental health. And to guide us and shed some more light on this in our studio today, we are very fortunate to have with us the former Director General of Central Council of Research for Homeopathy, Government of India, Dr. Manchanda. Welcome to the studio. And he's of course held many the posts and positions. Also was the former Director of Department of Ayush with Government of Delhi, India again. So welcome Dr. Manchanda to the show.
Namaskar.
So first up, we dive in my first question, and most of the viewers and audience would also have, is what is homeopathy, if you can explain briefly, and how does it relate to mental health?
Homeopathy is a unique system of medicine that treats patients holistically. Holistically means that for the treatment and management of, as a matter of fact, any disease, you have to consider mental state of the patient as well as his physical symptoms. Homeopathy believes that every disease, even if it is any physical disease, somewhere start from thinking.
Right.
So homeopathy has a very close relation with mental health. In homeopathy, we believe that if we are able to address mental health in any patient, his all physical problems will also eventually disappear, will also be cured. So
Right.
when we treat patient with homeopathic remedies, we consider that remedy that covers not only the physical problem, but mental state of the patient. And this is the reason you might have seen that whenever anybody goes to homeopathic doctor, he beside taking care of his physical symptoms, his physical you can say diagnosis, his investigations and all other things, whatever is required according to for the management of the case, he also takes interest in understanding the mental state of the patient.
Right.
What kind of mental state, how patient is responding, what patient is thinking about his physical condition, and what are his circumstances, his familial circumstances, all these things are taken into account. So homeopathy per se treats a patient holistically, wherein mental health is a very, very important ingredient.
Right. Very rightly said. So how do the homeopathic remedies differ from medical conventional medicines or medications when treating mental health disorders?
Actually, in homeopathy, we divide mental health disorders in different groups. I'll just tell you, not going into too much philosophical
Right.
details, I will just tell you that there are certain mental conditions which are as a reaction to some of the temporary circumstances. And there are others which are more chronic in nature and are somewhere genetic in nature. And then there are certain mental diseases or symptoms which are related to some physical illness. And there are certain physical illnesses also, like peptic ulcer, like many, which are psychosomatic in nature.
Right.
Irritable bowel syndrome, psychosomatic in nature. So homeopathy treats all these groups of disorders very separately and with a intricate process. When we come to homeopathic remedies, these remedies are different from the conventional remedies, because number one, they are diluted medicines, where safety of the medicine is absolutely assured. We prescribe on the holistic picture of the patient in every case, whether a patient is having mental health problem or even a physical psychosomatic problem. We take into account his mental condition at that particular time and select a remedy that covers all the symptoms. It is a syndromic kind of approach.
Right.
And these medicines are, because they are highly diluted, they are having no side effects and stimulate body's own defense system that treats the patient, that addresses the symptoms of the patient and treats him not only his physical condition but also the mental health at the same time. In that case, I would just like to say that homeopathy is very close to what the WHO definition of health is concerned, that you have not only to consider that whether there is a physical symptoms or not,
Right.
but you have to take into account the physical, mental as well as social well-being of the patient.
Right.
So homeopathy covers all these things very comprehensively, and our remedies are in a very diluted form, so they are absolutely safe.
Very interesting, very right. Of course, overall holistic health includes, as you said, physical, mental, emotional, social, everything. And so many times it is that your ailments also can cause you mental stress.
Absolutely.
Just the fact that, I have something broken, or as you rightly say, any other disease, and which causes stress and anxiety to the patient, which further aggravates conditions and situations.
So when you take homeopathy, all these anxieties and all those stresses all are taken care of by the medicine as well
Right.
as by the counseling that doctor gives while doing case taking. So this is also very important part
Yes.
of
I know
homeopathy.
I've personally, of course, been fortunate enough to have, I would say, healed with homeopathy, certain, ailments and things which I won't say that conventional medicine does not address it, but then again, a holistic approach of combining, different modalities, I think that works the best.
Absolutely.
So I absolutely can relate to that. So are there any specific, homeopathic remedies which, are recommended for, say, mental health issues, or is it something? It's everything is very, very specific.
No, I think in homeopathy the remedies are very specific, but there are still certain biochemic remedies.
Right.
Like people, I have seen people for relaxing, they take Califos,
Hmm.
biochemic remedies. But if we have to use, which is biochemic, I often consider as a sister concern of homeopathy,
Okay.
because they are biochemical salts. If you take these medicine even for long run, they are non-habit forming. They are absolutely safe, and that gives you relaxation. So,
So,
people often use Califos,
Yeah.
5-Fos for mental health issues.
Right. So just for the benefit of viewers, when you say the salt-based and homeopathy, just quickly, if you could differentiate between so that they can understand, what.
No, I'll tell you. In homeopathy, one is that you have to take a comprehensive symptomatic approach, wherein
Right.
you select 1 or 2 remedies according to the individual. The other is biochemic salt, wherein one of the biochemic salt, Califos, is
Right.
often related to relaxation of the mind. So whenever you will find any homeopathic combination on any homeopathic drug, they often contain this remedy. But there are other herbal remedies also which are used in different potencies in homeopathy for giving that kind of relaxation.
Okay, fantastic.
But those are very specific to the person, and that are required to be done by that exercise of selecting that medicine has to be done by a qualified homeopathic doctor who understand all the syndromic approach of homeopathy.
I think that's a very important point too, because often you find, since many of these, homeopathic medicines are available over the counter, so people read and start, prescribing themselves or doing, the self-medication in a way, and then obviously that could lead to some confusion, complications, etc. So always please consult, health practitioner, a qualified homeopath, and before taking any medications, while they are available over the counter, but for chronic, that's always advised. And of course, let me remind all the viewers that you can consult wellness experts on healthyram.com for holistic wellness of the body, mind, and soul. That's the whole purpose of this channel and the platform as well. All right, so the next question, very important is, research based. Everybody keeps talking about, what's the research that's gone into it. Pharma, of course, modern medicine, as we know, there's a lot of research and everything going into it. So, what kind of research has been conducted on the efficacy of homeopathy per se, in treating mental health conditions in particular?
I'll tell you, homeopathy right from beginning
Hmm.
is a very well researched system,
Right.
wherein all the experiments are being done on human being, because medicines are used in diluted doses, they are safe, and they can easily be tested on human being. This is the first fundamental issue of homeopathy.
Unlike modern
Unlike
medicine,
modern.
they do first on animals
First,
at
yes,
trials
now
mostly.
in even homeopathy we are doing some
Okay.
reverse pharmacology on animals, but
Okay.
primarily homeopathy we have, you can say, millions of symptoms related to mind and body,
Right.
where different drugs have been experimented by different people. Now all those things are available in the form of materia medicas and in the form of repertory. And these repertories are, this data has already been computerized. So whenever we use any medicine on a patient, we can refer to this computerized data, where experiences of doctors and where lot many symptoms of the patient, those who have been improved with homeopathy, are available readily to the doctors. And this is one aspect of thing which we often say, that opinion of the doctors, and where lot many case reports, case studies are available. This is one aspect. Then comes, there are many observational studies in homeopathy, where a group of depression patients were treated by a group of homeopathic remedies by different groups of patients. So those many publications are there. Here I would just like to quote one epidemiological study that was published in France, where they have shown that people, those who are integrating homeopathy in their life,
Right.
or doctors, those who are giving their patients homeopathy as an add-on to their conventional practice, they are using less doses of antidepressant in their practice.
Oh.
Their patients are using less doses of using less sleeping pills in their practice. So
Right.
these kind of epidemiological studies are very important. Besides this, there are even randomized control trials also of late, and some of the systematic reviews, they have shown that homeopathy have a positive inclination towards in depression, in certain other diseases where you can very well, data is available
Okay.
with us.
I think that's very important, because otherwise it is, so that there isn't enough evidence-based, medicine, as they call. Many times there's controversies been there that
Of
homeopathy
course,
is,
there I
treated
would
that way.
like,
So is Ayurveda and
about
others.
controversies, I would like to say that if you want to see the controversial side of thing, you can see controversial side of anything nowadays.
Totally.
Nowadays.
Yeah.
But in homeopathy, there is a huge amount of data. Experience of last 200 years is available. And homeopathy right from beginning is being practiced by medical doctors. Hahnemann himself, who
Right.
discovered homeopathy, was a conventional doctor.
Yeah.
So they were keeping records of those kind of things. Now it is a different matter. Now we want to see everything with the prism of randomized control trial.
Right.
Even in homeopathy, we have few randomized control trials in depression, in menopausal disorders, in many other diseases, where positive outcomes are there. But the data that practitioners still realize are mostly observational studies over a period of time, and these are nicely recorded studies.
Okay. Right.
And this data is still now being enriched by, there are certain now, you can say, digital platform where doctors are still sharing their positive outcomes, and now that is helping us to further refine the already available conventional data or traditional data of homeopathy.
Very, very interesting. I think that should also, give more insight. I think the very valuable insights that we're getting to hear from you today. A fantastic opportunity for all the viewers as well to get more insights into how homeopathy actually works, and in particular to mental health issues. So, another question that I have, and I'm sure a lot of viewers would be able to resonate with it as well, is um, how do patients typically respond to homeopathic treatments, and especially for mental health, and are there any side effects, like you been talking about it. They're very, it's in highly diluted,
I'll
not
tell
side
you, in
effects, but
homeopathy, I'll tell you, a doctor sees response first at mental health level. So even if we are treating any patient with a physical illness,
right.
we first focus what is his mental state,
Yeah.
whether that has that is improving or not. So homeopathy, whenever anybody takes homeopathy, his mental health is
Is
already
in
maintained,
totality, yeah,
it
right.
is already. So whenever we treat any patient, we see how his mental health is, how his general conditions are, and then we see what is happening to his physical, you can say, a physical illness for which a patient has come. So that aspect is taken care of. As regards side effects are concerned, as I told you, that it is sometimes possible that if our selection of homeopathic remedy is not that much accurate, there may be less effect.
Right.
But side effects, the possibility of side effects is not there, even if you do long-term use of homeopathy. This is the advantage of homeopathy, because our medicines are relatively used in non-toxic doses. So you can use even for a long time.
In fact, I hear this, and I also, online, of course, one reads about that sometimes when you start the homeopathic treatment, the condition aggravates slightly, and that is that true, or is that, I mean, case to case
No,
basis,
no, that
or
is not true in respect of your mental health issues. But sometimes what happens that patients are already taking so many drugs to
right?
keep their symptoms under control. And if you give homeopathic remedies and you stop all the conventional drugs immediately with the advice of the patient or with the advice of the doctor, or otherwise also, because most of the time I have seen that patients, those who are on psychiatric drugs, are reluctant to take those drugs, and they try to avoid those drugs.
Right.
So they themselves stop. So that can lead to aggravation of the thing.
Yeah.
But importance of homeopathy is that if you add on homeopathy, even with that conventional medicine, it is quite possible that in the long run you may not require those drugs,
Correct.
and you can manage your most of the symptoms and most of the condition with the help of homeopathy only.
Right. So again, the important thing, I guess, being that you should work in tandem with your conventional medicine or doctor that you take in the medicines,
Yes,
and
yes, yes.
gradually reduce them if you find improvement, rather than doing it on your
Absolutely.
own, that you just stop and you shift to
Because
homeopathy. Now
that
I'm
lead
taking this.
that sometimes gives blame to homeopathy,
Right.
that I have taken this dose, this has happened. That was primarily because
Due
of the
to
stopping of the
correct.
conventional drug
True.
that was keeping the symptoms under control for quite some time.
So the next question is kind of related to what we are talking about. So can homeopathy be taken in conjunction with traditional, conventional medicine or modern medicine?
Like, I think there is no harm in that way, because homeopathic medicines are diluted doses and they can easily be taken along with conjunction medicine, but it is not required in every case.
Okay.
Such situations are required where the patient is already drug dependent. Such situation is required if a patient is having very violent kind of situation. But
Right.
in normal anxiety disorder, in normal reactive depressions, and in mild to moderate kind of thing, you don't require any conventional drug along with it. Rather, it is better to be on homeopathy and use it, because these are non-habit forming, and
Right.
you will not have any short term and long term any side effects of it.
Yes, very, very important. Uh, so now the next question which comes to mind is, is there any difference in the approach how homeopathy or a homeopath would, approach a mental health issue versus, traditional, say, psychiatrists or, in modern medicine? Or they're similar? Or are there any differences?
Homeopathy doctor approaches patient with and makes two types of diagnosis. One is the diagnosis of the disease, and second is the diagnosis of the patient. Diagnosis of the disease means that what kind of conventional diagnosis you can make, because that gives an idea of what is the background of the disease and
Right.
how you have to do the general management of the patient. But diagnosis of the patient help doctor to decide about the homeopathic remedies, homeopathic drugs
Okay.
that are required to be given. So homeopathic doctor makes two diagnoses in every case, and one diagnosis also helps him in giving right kind of counseling to the patient. I will tell you the intricate process of case taking in homeopathy,
Right.
wherein you ask from the thought process of the patient, reactions of the patients, his family background, his vertical and horizontal history, his current socio-economic conditions, and how he is responding to that, gives you an overall picture. And that is very, very important for the treatment as well as for maintaining mental health in any patient. So it
Right.
gives us a very, very comprehensive coverage to the patient as regard homeopathic management is concerned. So homeopathic management is a complete management of the patient. It's not related to just one part or one disease of the patient.
So in the true sense, it's actually holistic healing of the person,
Absolutely,
understanding the
absolutely.
person completely rather than just going symptomatically and saying,
Absolutely.
okay, you have a headache, you take this pill, or you have that, but you get down to the deep. So, and mental health issues even more important.
Absolutely.
So, is everything kind of homeopathy can address the entire, all kinds of mental health issues and illnesses, or is there something that homeopathy does not work very well in your opinion? So like
I
you
have
have
seen,
today, you know.
no, in our experience, we have seen the patient, those who are very violent. Since we do not have that kind of palliative remedies and immediately controlling those states, sometimes homeopathic doctors have limitation in managing those patients,
Okay.
especially in cases of very severe cases of schizophrenia, very severe cases of bipolar disorders.
Right.
So we have seen that it is difficult to manage with homeopathy. But even in those cases, once that violent episode is over, homeopathy has a role to play. And even sometimes we have cases seen that there are certain refractory cases of bipolar disorders and refractory cases of schizophrenia where they have taken lot many conventional drugs and are still not completely getting all right. By adding homeopathy, you can address many of the symptoms
Okay.
of the patients and can give lot of relief to the patient.
So how do you respond to the skeptics, so-called, who question the efficacy of homeopathy in general, and in particular, of course, mental health issues. I think even more intricate, even more complicated. It's not a simple thing where you look at and I mean, personally, I think it's the most important and very intricate, very complicated. So many different aspects associated with mental health. So how do you address those skeptics?
For addressing skeptic, there are two things. One is our short-term strategy. That for that, as I have told you, that we have sufficient number of data
Right.
that has been collected over a period of time by different physicians in about 100 countries of the world. So
Right.
that data is already available, where homeopathy has shown and have been found effective. I will not use the word efficacious, but effective.
Right.
Because efficacious word we use when it is compared with placebo. So there are not many placebo controlled trials, but if we just leave aside placebo controlled trials, there is sufficient number of data of observational studies as well as epidemiological studies as well as real time practice data that has shown homeopathy to be quite effective in mental health issues, especially in day-to-day mental health issues,
Right.
which are not yet drug dependent. You can manage society, you can maintain the health of the society with these homeopathic remedies without going into lot many antidepressant, sleeping pills and anti-anxiety drugs. So
Right.
this is how where homeopathy has a very unique position and a role to play.
And I think somewhere down the line, everything starts with these things, and then you keep neglecting it, or it keeps growing on you. So anxiety, stress, depression
Absolutely.
can lead to even further complications, or even more diseases.
Absolutely.
So I think it's been an amazing session so far. I think on the a last question there, on the show, what advice would you consider giving somebody who's wanting to look at homeopathy as a treatment option, especially for mental health concerns or issues?
So I would like to advise them that first of all, they must take treatment from a qualified homeopathic doctor who has institutional qualifications.
Right.
Now in India, we have about more than around 300,000 qualified homeopathic doctors available in all parts of India.
Right.
So you can take advice from that. Don't go just like that, and don't go by hearsay, and as you had mentioned, just by using, since these drugs are available at OTC, so you can just pick up and take.
Right.
This is one aspect, and the other aspect is that the objective of OTC, making homeopathy OTC, was not that we should encourage self-medication. It was primarily because we wanted that these drugs are available all over India. Any doctor, if prescribes, if any qualified doctors guide you, you should be able to get those drugs readily on any chemist shop. So this is how these drugs are OTC. This is one aspect of the thing. And the other is that try to adopt homeopathy as a first line of treatment whenever a mental health issue comes. Because homeopathy treats mind as a primary object.
Right.
So you can be even saved in the long run in developing any type of mental illnesses also if you use homeopathy, not only for mental health, even for your day-to-day physical problems. So homeopathy believes, like mind, body, soul, homeopathy do believe that there is a mind, body and soul, and we need to heal soul, and that can only be healed if we take into account the mental state as well as physical state of the patient.
Right.
So we use mental and physical state for the treatment of the soul and whole body. This is how it is holistic system.
Fantastic. I think it's been an amazing session. I'm sure the viewers have also been enriched, with your insights and the expert advice that you've given. So extremely important today's day, and not just today. I think every day should be a mental health day, because it all starts in the mind. If you have a sound mind, you can take sound decisions. You can understand what's going on with you and even around you. Right. And as we keep saying even at Healthy Ram, that for any development to happen, most important is that you are at a sound mind, a person with a sound mind, to be able to take the right decisions, whether for yourself, to apply the acquired skills or knowledge that you have for economic development of yourself, of the organization or the society or the world at large. And please do not neglect mental health. Take it very seriously. At the same time, be joyful, be cheerful, and do not take unnecessary stress, anxiety, because it all starts there, and it applies to all ages. Very important to have your me time, very important for you to unwind rather than constantly being on the run and keeping your mind always occupied with something. Just sit down, relax, enjoy your music, your cup of tea, just enjoy looking at nature, being with nature. All small little things that go into de-stressing yourself. And as Dr. Manchanda rightly said, if you can detect and start early, and that will help in going a long way in avoiding complicated mental health issues down the line. So with that, take care of yourself. Thank you so much, Dr. Manchanda, for dropping by
this
the
opportunity.
Studio. Yeah, it's a
and
pleasure.
Take care of yourself, your mental health as well as your physical health.
Absolutely. And of course, you all know, if you need any expert advice on holistic wellness, please do consult our wellness experts at healthyram.com. And if you like the content, what we are bringing to you, please like, share and subscribe, and spread the word and spread the joys. Keep smiling, stay healthy, stay happy. Until next time, we'll see you soon.
Support to empower. World Mental Health Day Mega Workshop.